This evening, we continue our Healthcare Hustle series with an investigation that took our team to another state. Our Perry Elliott-Durrani explains in this special report.
Yesterday, we heard from Arkansas healthcare leaders about how they're focusing on residencies to address the state's growing need for more physicians. But that vision will take years to materialize. So tonight, a look at a telehealth solution that may buy Arkansans some time. As Arkansas tries to address its physician shortage, its patients need somewhere to turn.
I think that we need all the help we can get.
State Representative Lee Johnson says one way to expand healthcare access is telehealth. But this pool of physicians is still limited by the number of doctors in the state.
If there's a physician in Wyoming that wants to provide telehealth care to some patient in Arkansas, they have to be licensed in Arkansas. So it does create some licensure challenges.
That's where Marshall Smith wants to come in.
We've created a faster way to get that license.
Smith is the director of what's known as the Interstate Medical Licensure Compact, an agreement designed to make it easier for physicians to work across state lines.
It turns a process that can take 3 to 6 months for a physician to get a license in a new state and boils that down to about 7 to 10 days.
Here's how it works. Doctors will go about getting their first license in their home state normally. But when they apply to any state that participates in the compact after that, they'll get to take advantage of this expedited track. Doctors will still need to follow the specific state laws of whatever state they're operating in.
So each state doesn't have to do its own licensing process. Another state's already done that. They accept that process and then issue a license.
But states have to join the compact first. And while 37 states are already a part of it in one form or another, Arkansas isn't one of them.
I think it's something we've looked at hard in the past and decided at that time it wasn't necessarily the right move for the state, but I think it's reasonable to start looking at that again.
So, while lawmakers in Little Rock are looking, our team traveled to a state capital where leaders have been using the compact for almost a year, Austin, Texas.
So far, it's gone really well. It's been pretty smooth.
Stephen Brent Carlton with the Texas Medical Board says since last March, over 1,000 out-of-state doctors are now able to work in Texas, all without spending taxpayer dollars.
It's been a net positive for the state. We're bringing in more revenue than it costs us.
The Patient Choice Coalition's David Chipkoskis says the compact also makes it easier for doctors to move to a member state permanently.
And they don't even have to lose their patients. Their patients can still remain in the state that they're moving from.
In the Texas legislature, the bill adopting the compact passed almost unanimously. But as the sun sets on the first year of its run in Texas, the compact's novelty is what worries other lawmakers and what stopped Arkansas when the state last considered it in 2017.
There's that concern that if you are licensing people in an expedited license fashion through the compact, that you're giving up potentially some of your primary source verification ability.
But since 2017, the compact's board says only 21 of their 15,000 licensed physicians have faced disciplinary action, lower than the national average. And Carlton says the quality of care hasn't suffered.
Each state is going to have to look at it on an individual basis and make sure it's something that is right for them. But I can say it has been good for Texas, and I'm glad that we move forward with it.
An out-of-state solution that could keep Arkansas's telehealth patients in the natural state. At last check, no bill has been filed this legislative session to bring the compact to Arkansas. To learn more about the compact, we have an in-depth article with voices we didn't get the chance to include here on our website. Perry Elliott-Durrani, Fox 24 News.